Are you tired of the quick fixes that promise transformation but leave you feeling more disconnected from your body than ever? Welcome to Beyond Medicine, humanized care for women of influence, where we go deeper than surface level solutions. I am Dr. Maria, a functional integrative physician specializing in women's health, metabolic dysfunction, and hormone balance. We will uncover the root cause of insulin resistance, PCOS, thyroid, and adrenal issues, and explore how trauma, stress, and anxiety impact your well being. Because your body is not a microwave, it deserves personalized, compassionate cares that honors its complexity. Let's embark on a journey to reclaim your health one conversation at a time. And today I have with me in the program Dr. Reincke, if I am pronouncing that correctly.
Yes,
She is
ma'am.
good. A board certified interventional radiologist, and she specializes in vein health. So I will welcome her to the program and to the chat, and I will allow her to introduce herself at this time.
Good morning, everyone. Happy Friday. I am Dr. Reincke. I am a board-certified interventional radiologist, and I own Reincke Vein Center. I am the sole practitioner and sole owner of my practice, which actually tomorrow is my 4-year anniversary of solo ownership. So before that, I did practice. I've been practicing for the last 10 years, but I've been a solo owner entrepreneur for the last 4 years.
Ah, I didn't know that you had been like for so long.
Yes. Yeah, it's awesome. It's been an amazing last 10 years, actually. It's part of a group when I first started out, was part of a group. And then I became the Texas medical director of another vein center. And I opened 3 locations here in Houston, actually. And then, unfortunately, I got outvoted, and a private equity firm took over for our group, and it just became, for me personally, it was too corporate. And so then I decided to venture out on my own. Best decision ever, because now I get to make the decisions that are, obviously with patients helping me and being their advocate, but that I feel are in their best interest, not just from a business perspective.
Wow. So it's very interesting, that you have been on your own for 5 years, in your journey. And when I say on your own, that can seem like negative. Yet there is a big difference of when you are a physician plus a business owner and you administrate and you do multiple things besides just seeing patients. And it's not that seeing patients is not important. I didn't say just because that's not important. And that's not by itself hard and challenging. Yet being a business owner then adds a different level of complexity,
Yes.
the work that we're doing to our lives and how we're going to manage everything. So let's talk a little bit, about that journey. How has your journey looked within healthcare and in your life? So how did you get to now being a successful business owner for 5 years that have been able to continuously serve the population here in the Houston area?
Well, it has definitely been very circuitous. I initially started out, I was a surgical ICU nurse, and I worked at Indiana University Medical Center and took care of open heart patients and transplant patients and big abdominal surgeries. So I did that for about 6 years. I worked there, became the charge nurse, and loved my job. But being the first person in my family, I think, to go to college, I I just took baby steps. So that was the first step for me. And I would be, I'd be in the unit and I'd see all these resident physicians coming in, and I just kind of kept thinking like, I think I can do that. So after nursing, I went on, and my next step was I became a physician assistant. And I worked in neurosurgery, brain and spine surgery, with a group in Michigan. And I did love that, actually. But my senior year of PA school, I took my MCATs cold. I wouldn't recommend it, but I did it. And I worked for the neurosurgery group for about a year, and I actually got in the next year to medical school. So I went to Wayne State in Detroit and did my 4 years med school. I did 5 years of residency and then a fellowship. And my fellowship was in interventional radiology. So kind of catheter-based procedures.
Yeah. So a long
Yes.
journey. So question, during that long journey, how as a woman have you been able to take care of yourself, and how does that look like?
I would say if I were, yeah, what I would say is this. I think a lot of my healthcare or prioritizing me got put on the back burner. And so I could get through all of my education. I actually had both of my children in medical school, which was the hardest thing I have ever done. Lots of tears, and stress was off the roof. Luckily, I was married and I had an amazing supportive spouse. So I was able to do that. But in terms of my own healthcare, I think a lot of it just, I couldn't prioritize that. So there were definitely some things that now I've been able to address that I was not able to for 18 years of training.
Wow. Wow. Very, very long journey. That is
Yes.
like until you become like a teenager and then you're out of your parents' home. And I think that, it is important because sometimes, and this can be very different. And I think that also at this time in culture, some of this has changed. But I think that women usually receive the message of, or at least where, in my culture, in the Hispanic culture, women receive the message of do something that will allow you to like be a mom and take care of the family. And it's not that those other things are not important, but I think that sometimes when women receive these messages, it puts you like in this little ball that then you cannot see outside of it, and you might be afraid of doing something that is truly the desire and the passion in your heart. And
Mhm.
I think that you are a great example of, maybe my journey doesn't look, I went straight from high school into a 3 year pre-med and then medical school and then the fellowship, and here I am. Yet you do show that if there is this passion and something that you want to do in your heart, you can go through that journey as it looks. It can be different. And I'm
Mhm.
sure that you can relate to the fact that your journey comes with lessons that if
Yes.
you would have done straight pre med and then medical school would look very different. So I think that there's value, and I think also that that message of journey, persistence, resiliency. I can do it no matter the time. I can do it no matter I'm a young woman. I can do it in spite of my
Yes.
family background, right? The resources that
Hmm.
I come from really can be an example for other young ladies or teenagers that
Hmm.
are like, oh, this is really what I would like to do with my life. Yet I'm not sure that I can do it or how long it will going to take and will it work. So all of that being said, so that we can kind of like wrap up a little bit this topic in terms of, so let me put it this way. So if there is a 15-year-old or a 16-year-old that is listening to this episode, what would you want her to know about perseverance
Yeah.
for my topic, but you understand the word I'm trying to say, and resiliency as a woman, and not only as a woman, but perhaps as a woman that, for whatever reason, comes from a background where resources might not look like they are there to help her and support her in the journey.
Well, what worked for me, I do think I have a strong passion. The biggest thing that maybe I would say would make somebody successful is grit,
Mm,
perseverance, right? Like you said, resilience. But what I've tried to do is do mentoring, let people know I am this kind of anomaly in medicine. Although I think that there's a lot of people, the more that I have practiced, that I realize, there's a lot of us that didn't have resources, that didn't have mentors. But with the change in medicine and culture, especially for women, now what I do is I make sure that people know that they can reach out to me. And so if I were to say to that 15-year-old or young woman, which I often do via social media as much as I can, let them
mm,
know this was my journey. If you want to reach out, I'm available, and people do reach out to me. But I would say, like, connecting yourself with somebody who's been through it, that's
mm,
open to helping you. And I absolutely am. I would say, besides patient care and being an advocate for them, that's probably ties for like my passion is helping young women out that have maybe no idea how they're going to get there and don't feel like they have resources. Because it would have been certainly easier for me if I did have those things. I did not, but
mm.
I want to be available for young people to know, like, you absolutely can reach out to me, and in whatever way I can, I'll help you.
Yes, and I think that it's important. So you mentioned, uh, I'm going to use the word like community or relationships.
Yes.
I think that in this day and age, and especially in the American culture, we can easily go into, I need to do it by myself, the independency, self-reliance. And I personally think that, yes, there are some really good attributes of when you can show some independency to do certain things. But the reality is that, and I have learned this, anything that you're going to do in this world will require of others,
Yes.
whether that's family, friends, co-workers, colleagues. It will require of other people, of your
Hmm.
connection, of your community, of your networks. So I think that that's really important that you're mentioning that if you are listening to us and you're like self-reliance, I'm going to do this on my own, or you think that you have to, then no, there's people out there that have walked the journey before and that are happy to help you and let you know, hey, these are the lessons that life has taught me. I'm just saying these are my
Yes.
lessons, but definitely they can help you in the
Hmm.
journey.
Yes.
So thank you for sharing all of that. So
You're welcome.
yeah. So for the listeners, before we started recording, we were talking a little bit about similarities. I can't talk this morning. But things that are similar between the population that Dr. Reincke serves and the women that I serve. So I don't serve completely female patients, but the majority of my patients, yes, they are female. The
Mhm.
majority of my patients, I would say they are 40s to like early 60s. I do have some
Yeah.
late 30s, but one of the reasons that the age that I see is more in that category is not necessarily because people in their 25s or 30s are completely healthy, but rather one of the things that I see, especially in women, and we were talking about this, is women tend to prioritize everything else, especially kids and family,
Mhm.
and then they come back to their health. So tell me a little bit about your experience with this, not only as a physician, but also as a woman that, without telling our ages, I am going to guess that you are further ahead of me in your life journey.
Mhm.
So tell me what you have learned perhaps with your patients of maybe why is it that women tend to postpone their health as the second priority, and what that might mean, or I don't want to use the word consequences because that's negative,
Uh-huh.
but how this prioritizing others, which again comes from the message that women tend to hear in culture. So, how is it that prioritizing others can affect women's health?
So yes, I also kind of delayed some of my own healthcare while I was busy training, medical school, having children, which I did. I breastfed both of my kids, so I was carrying, things were really different when I was in medical school. We didn't have streamed lectures. So in order for me to breastfeed my kids, I had to take them to class. And that's just what you did. Every day I was hauling them for the first 3 months. But so yeah, I definitely put off some of my own healthcare issues in order to take care of my babies. And honestly, I didn't want to have to choose one or the other, so I didn't. And I'm glad I didn't, but I also did not have help or family in the area. So it was super challenging. But personally, I did put off some of my own healthcare issues. For my patients, it's kind of the same thing. I have the same demographic, the same age kind of demographic that you do, that I see. It's not exclusively women, but it's more common in women than men. And I hear I hear the same things. I mean, I'm a woman, and oh, by the way, I'm a physician. So when my patients come in and they start talking to me about, yeah, I finally, it's an empty nest, my kids are gone now, they're at college or married or what have you, and now I get to prioritize my health. And so I see that same thing in my patients, and we definitely can relate in that sense. Um, for my patients, what I treat, it's not, it's not life and death. And
Mm,
so delaying treatment isn't for them isn't going to be significantly impacting their quality of life every day. Um, it just might mean that their symptoms get worse because certainly what I treat is a slow and progressive disease. So it's something that kind of sneaks up on you, and then you might say, wow, my legs really hurt or they're really swollen. So wherever a woman, a patient is in their healthcare journey with what I treat, most of the time, unless it's really advanced, it's, you know, there's no shame in it. It's just where you are, and let's talk together about if you would benefit from getting some treatments for that.
Right, right. And I think that that's important. That in a way we are not here to like shame, women. I
Yes.
actually love a lot working with women and especially empowering them.
Yeah.
Because I feel, and again, my background is more Hispanic, which culturally is a little bit different than other cultures. But I do feel that sometimes, depending on that upbringing, where you come from and how you're formed, it can be disempowering for women. Or it can be a message where, again, puts you in this bubble of this is how life has to be, and this is what you need to do because this is what good women do. And I think that it's very
Mhm.
important that also, if you are a woman, that because you have prioritized your kids, family, career, whatever reason, you have waited and now in your 50s, that's usually when I see like in their 50s, they come and
Mhm.
like there's all of these things going on, and they start to notice all of these changes in their bodies, that there is no shame and never is late. So you are not late if you came and you seek out help. But I think that at the same time, I do want, women to know that, especially when if you're a woman and you work with a woman physician, we can relate to not only the changes
Mhm.
happening in your body, but at the
Yes.
same time, the perhaps like added stressors or the demands that women that have both like a career and then family might have to be able, to do everything. And that at the same time, I also know that some women really struggle. Like, do I prioritize this or do I prioritize that? And how can I balance it without one getting affected versus the other? And
Yeah.
trying to keep like everybody happy. And so I hear you. And that's why one thing that I always tell to my patients is you always have to love yourself first. So not even from the
Mhm.
perspective of, going to the doctor's visit, which is kind of like the doing, but can you live from a place where independently of what you're doing as a woman, whether you are a mom, a caregiver of your elderly parents, a CEO, six, seven figure CEO, independently of that, of the doing, you have the being. And can we start with taking care of the being and loving ourselves, however that looks, and for you, because it looks differently.
Mhm. Yeah. Well, what I would tell you is I have that same philosophy, and the way that I interact with patients is from that space,
Mm,
and there's no pressure for my patients to get into treatment.
mm,
My focus with all of my patients is empowering them through education, allowing them, giving them all the tools that they need to maybe become aware or even know what's going on. So sometimes patients don't even know, all they, maybe it's just what they see visibly on their legs, but they don't even know that that is related to what I treat. But my goal with patients is just to educate them. There is something a little bit deeper going on. Again, this isn't life and death. You do not have to get it treated. Here are options, everything from conservative management or doing nothing. You don't have to do anything to, hey, here's something that would be proactive, but not, again, it's not life and death. Really, anytime I treat a patient, there are more advanced cases that I'm a little bit more encouraging, I'll say, to them. Like, I think it would be in your best interest, right? I am a physician, and after all, I am supposed to be their advocate. And sometimes advocating means letting them know, I think you really should get treated because it's advanced. But the majority of the time, this is about educating people, letting them know that vein disease exists, and then allowing them to make informed choices wherever they are in
Right.
their health journey. Mm-hmm.
Yes, absolutely. So let's talk a little bit then about your area of expertise, okay, which is
Yes.
vein health, which is different than arterial health. So let's talk
Yes.
about that.
Okay.
Veins versus arteries in a very simple, and we're not going to give a medical school class, like a very simple what's the difference
No.
between veins and arteries.
Yes.
Then what are some of the common things that you see women come with, struggle with? And again, in very simple terms, one, things that on their own they can do and try at home. And two, when to seek help
Okay.
and how that help can look like. So a couple of things.
Yes. Okay. Let's see. Let me go back to veins versus arteries.
Yes.
Okay. Arteries are on the high pressure side of the heart, and I don't treat them, but I do comprehensively check to make sure that patients have those arteries provide oxygen and nutrients to the tissues. And so I always do check patients' pulses, which is an evaluation of the arterial system, the high pressure side, before I would do any potential procedures. I work on the low pressure side of the heart. This is taking blood back from the legs to the heart. And patients who have vein issues, vein concerns, vein disease, have big stretched out veins, and the blood's going the wrong way. It's going towards their feet instead of towards their heart. The number one risk factor for having vein disease, these big stretched out veins, is genetic or hereditary. So if just one of your parents has vein disease, you have a 50% chance. If both of your parents have it, it goes all the way up to 90% chance. Yes. And so that's the first thing I teach patients, like the likelihood that this is about something you did or didn't do, that's not your biggest risk factor. Because I do have patients that'll come in and say, well, if only I had done this or that. And the majority of the time I let them know it's not anything you did or didn't do, so don't feel guilty about that. It's really your genetics. Just like me. I mean, this is what I'll say to them. Look, I'm a tiny woman. And I'll say this, like, I'm a good kid. I don't smoke or drink or do drugs, and I'm a vegetarian. And yet I have high blood pressure. Explain that, right? Like, no matter what I do. So it's genetic. And that's for my patients. I definitely want them to know that as well. Like the likelihood, this is how you got it, genetics. And then there's some other things that kind of play into that. So let's say you're predisposed to having stretched out veins with backward blood flow. And then being a woman, because of our hormones, so estrogen and progesterone, which are the female hormones, those cause relaxation of stretched out veins. And so it's a little bit more stretch. So our female hormones are another risk factor. An occupation where you sit or stand, whether that be a homemaker or you're outside the home, it doesn't matter. If you're sitting or standing a lot, that's a risk factor. Multiple pregnancies, kind of for the same reason we talked about female hormones. So that's another thing. Obesity actually is as well. So having extra weight, especially in the abdomen, it just puts like more backward pressure on those already stretched out veins.
Right.
And so then getting into the next sort of part where we talk about, so what does maybe a treatment plan look like? Everything from nothing to procedures that I do.
Right,
The
right,
first thing
right.
I talk to them about is the conservative measures, which is doing nothing from a procedural standpoint. But at home, I talk to patients about, wearing some compression socks, just puts like a little hug on those stretched out veins. And it symptomatically, it makes them feel a little bit better. So that's something they can do easily. I don't sell compression hose. I don't have brand names that I recommend necessarily. I'll usually ask my patients, what do you use that works? And then tell my patients, this is what another patient found. So it's per the patient. And I'll tell them to go on Amazon and get some cheap ones. So elevating their legs, drinking plenty of water, getting exercise. Those are conservative measures. And we can all do that.
Yeah.
And then if they've tried that and they're still not getting relief, they're still having tired, heavy, achy, bulging veins that hurt them, itch, skin changes, those kinds of things, then it might be time to consider getting an ultrasound, which we do here in the office. Takes about maybe 45 minutes or so, and we're able to then pinpoint what veins are stretched out and have that backward blood flow, and then talk to them about treatment options.
Right, right. So, one of the things that I am glad that you mentioned is that there is this genetic predisposition. And part of my training is not only family medicine, but I also did lifestyle and integrative medicine. And yes, I highly believe in examining what we can do in terms of lifestyle that is under our control and to our reach, because
Yeah.
sometimes there are barriers. Life cannot be perfect. I'm not going to go into all of this. There's a very fine line between chosen lifestyle and post lifestyle, but within that, knowing that we can be doing like all the right things, yet if your genetic predisposition, and if you have the copy both from mom and from dad, and that makes it even stronger compared to having just like one of the copies of the genes, then it's also important to come from this perspective towards patients of like, it's not your fault, it's not that you're not doing enough. And
Mm-hmm.
at the same time, I I once heard a patient tell me, that she was frustrated because why didn't her body respond the way that it needed to respond? Because sometimes those are the messages that we get from, the culture of like, if you do this, then this is the results that you need to get. And sometimes we forget that we all come from, a genetic composition that can make some things work and some other things not work, or maybe not completely. So I want people to hear that, and that
Yeah.
is okay.
Yeah.
I love that you said compression stockings. I have never used like compression stockings yet. And that's why I put it like in parentheses for those of you who are actually seeing it. Yet when I used to do a longer shifts, I had of the socks that are all the way up to the knee for like runners, like for marathon runners, which they're not the medicated grade one, that sort of stuff, but still, they would really help in preventing, and even that I don't have like a condition, but I would get by the end of the day, you do start to feel that achiness, right? In your,
Yes.
especially in the
Mm-hmm.
lower legs, right? Not so much the
Yes.
thighs, but especially in my legs. I never would get the swelling. So if you're wondering what to use, something that's like, the the socks that marathon runners also use. That can
Mhm.
be an option. I don't know necessarily the difference in terms of like cost. So that's something that you need to look. Now, I can tell you this, they can be much prettier, and you can buy it with like the theme that you want. So it can be a little bit more fun. So
Mhm.
are there any so for women that maybe perhaps are like, okay, so I'm using the compression stockings and I'm moving and I'm, drinking water, and if they needed to lose weight, they have lost the weight, but they still continue to have problems and issues. Just give us,
Mhm.
as we come towards the end, like a quick um you know, what are some options in terms of like treatment that then they can ask for?
Okay. So the first thing I would tell them, I think this is really important, and I've done quite a few just really short talks. Education on this is make sure that you go to a board certified physician
Mm,
that is a specialist uh, in that area. So for
mhm,
me, my biases general surgery, vascular surgery, interventional radiologist. We've had the
mm,
training for this. So that's the first thing I would say is do your education. Go find out. It's easy to find out from we're here in Houston, but the Texas Medical Board, what somebody's board certification is. And again, I'm admitting this. I understand that this is my bias, but it's like the difference between cosmetic and plastic surgery, right?
mm,
Cosmetic surgeons, anybody can be. A plastic surgeon is a board certified. Same thing with me. A lot of people could claim to be a vein specialist, but maybe they didn't actually have training in the things that I described. So that's the first thing. Second thing is procedurally wise, they do have options. And what I would say is for me, they're minimally invasive procedures done with a catheter, which is like a flexible straw, ultrasound, numbing medication. And the beautiful thing is patients are back to their normal activities the same day.
mm.
Yes. And that is going back to what we first started talking about. For me, it has come kind of full circle professionally because when I was a surgical ICU nurse, sometimes if back then they used to do vein stripping procedures for the issue, which is vein disease that I treat. And sometimes if there was complications, those patients would come up to our surgical ICU for like a short stay so we could manage their pain and
Right.
watch them. And so now as a physician, I see patients that don't have general anesthesia, don't have surgery, and don't have a 6-week recovery time. So it's not magic, but it's an amazing procedure that allows people to get back to normal activities the same day. Not everything's done in the same day, but you stage it. But I think
Right.
the important thing is you're not missing work, having to get a babysitter, burning vacation time, etc. Right? And that's touching on that part about like women and you're multitasking and you've got kids, etc. So something here that we also do is on Saturdays, although I don't post this, if you're my patient and you need a procedure so that you don't have to do all those things that I just said. Get a babysitter, have somebody watch your children, pick the kids up from school, take them to activities, whatever. I do procedures on Saturday mornings also. So if
Yeah.
that is helpful, great.
Yes, and I think that it's important that women, uh, and if there is any female, male patient listening to this, also know that treatment is not necessarily complicated. Sometimes when people
Mhm.
hear the word interventional, they yeah, they might not necessarily understand that it's not necessarily a surgery where you need to go, to the OR, be put under anesthesia, go to the hospital, like the
Oh,
complications associated with those type of procedures. So
yes.
I'm glad that you share not only, very briefly treatment options, but also that the treatments can be done same day in the office. They're easy and they won't ideally interrupt, your life for a couple of weeks. So thank you for sharing that. As we
Yes.
come to a close, so two questions. One is any last words of wisdom in any area of the topics that we have spoken about that you want to share with the audience? And then two, where can people find you and how can people connect with you if they have a need for vein health?
Okay. So the first thing that I would say is only thing that I didn't mention is if somebody isn't sure or just has some concerns, I do provide free consults, like free, not hook you and then, there's this surprise. I'm just saying this because sometimes it's out there, other people, what they do, but I just want people to know, like, legitimately, if you just want to know, hey, is this what you treat? Is this a real medical condition? Like, whatever the issue is, you can come in. I see all my patients myself. So I will see you as the physician. I see you and I will go through your concerns. And it's usually like 15 minutes or so. It's brief, but it's free. And it's going to be able to tell, I will be able to tell you by the time you leave, yes or no, you have it, you can live with it, or you might want to consider something. So that's one thing I would say. It's an option, and hardly any physician I know these days does anything free. Everything is billable. So I think it's a good thing. And then if you want to find me, my website is my name, which is Reincke, Reincke, veincenter.com. That's vein, VEIN, center.com. I'm on all the socials. Everything I do is educational. I mean, my personality is just not like super silly. I don't apologize for that, but I really focus on education. On Instagram, it's Reincke, then underscore vein, dot center. So got a decent following on my website, and tons of information, or on Instagram, tons of information on my website, everything from videos to all the procedures that we do. So we would be happy to see anybody that, even if you just want to learn about it, we're here.
Right. Yeah, absolutely. And I will put the information in the show notes. So if you are listening and you are driving or cleaning the home, or I don't know, outside in a walk or a run, and you're listening to this, don't worry, it will be on the episode show notes. So thank you, Dr. Reincke, for your time, your expertise, and sharing your journey with vulnerability and authenticity. I think that people need to hear that a lot. The journeys of physicians. One, because people can then understand, kind of like, hey, this is where we're coming from. But then also for other younger females that are thinking about the journey of medicine, knowing that there's different pathways, different alternatives, and that anything in life is reachable and never is late. And yes, thank you for being here.
Thank you for having me. I
Yeah,
really appreciate this opportunity.
yes, thank you. So to the listeners, thank you for being here. And if this episode was helpful for you, please share it with a family or with a friend. Until next time, bye.